Hi, Dr. Lindsey here. This is another in the series of how we do certain cases and certain approaches at the office. Today I'll go through what we call a frontal U case, and that's where we do a medium or large size case but preserve the frontal tuft for a couple of reasons. One is it lets the patient frame their face with their existing hair and camouflage the fact that they had a hair transplant, but at the cost of, if that frontal tuft is to go away, it goes away from male pattern baldness later on, we have to come back and hit it. But once we have hair put behind that, it's easy enough to come back and do a small frontal tuft. So one of these cases is a pretty quick growing guy, maybe around 40, and the other is a slower growing repair case from elsewhere of the mid to late 20s. But they both grew in pretty well, and hope you learned something from this video. Thanks. Okay, so here's case one. This is I think he's about a 40-year-old fellow who still has a decent frontal tuft. Not great, but he says that everybody in his family tends to maintain that until old age. And then a significant area of hair loss behind this. When he tilts forward, it's easy to see his tuft and then all this area to work with. So I offer these fellows a couple of choices. One is just to start at the front and work back. The advantage of that is that you never really have to come back and deal with the tuft again. The downside is that by shaving this and working back, you certainly look different until things start to, until the original hair starts to come back. The advantage of doing this modified case is we leave this so that the face is still framed. The downside, of course, is that if this goes away in the future, you have to come back and address it. And he's got fairly short hair. I encourage all of our patients to have roughly ½ inch long hair to cover our strip scars. Everybody hears it twice. A lot of people decide they're going to get a haircut to help me out, which only hinders their ability to cover the scar. But since hair grows ½ inch a month, it only takes a week or so for usually a short haircut to get long enough to cover a scar at our office. So here's our treatment plan. We're going to work around the tuft, pack the triangles, singles here, doubles and triples, and we'll go back as far as we can. Here's his donor region. He's got dense hair, but it's fairly fine and straight hair. Immediately after taking the strip out, he's sewn up. If he had just a little longer hair, you'd never see these stitches. These stitches will come out in 6 or 7 days. And so the first one of these I did, this was maybe a little more pronounced. It looked like a U, so we call these frontal U's. The nose is up here in the front and the back of the head, and so this is the front of the head, and it's a U-shaped recipient area. And here's at the end of the day. All the grafts are in place. He's packed really quite nicely. You can see lots of multi-hair grafts in here. Edges are packed with singles. Here's at a week. The stitches have just been removed. It's difficult to see the scar line even with this short haircut. And he did a reasonable job of keeping things clean. And from the side view, he did better than reasonable. He did a very good job of keeping things clean. The front is up here, the back. So let me see him back in a month. And this is a frontal view. Hey, it looks like he's had nothing done because we really didn't do anything in the tuft. And he's still got a few hairs hanging on. Bend over and you can see that he's really lost almost everything we put in. Looks like he did before we started. But by preserving that tuft, the frontal U, he really doesn't look like he's had a hair transplant. But again, the cost is, if and when this goes, we're going to have to come back and deal with it. And 1 month with ½ inch long hair, you can't see anything. There's a scar line right across here. He rolls in at 5 months for a check. Maybe a little bit of an early grower. Remember, we did not do this, but the rest of this is our case. 5 months, he's starting to grow. 5 months. We did not do the tuft, but everything else is ours. Scar line at 5 months. Right there. Pretty good. his crown at 5 months. We didn't do anything in the crown. His crown's no different. I took this picture mainly to show with the current hairstyle. You certainly couldn't find that little scar that we put on him. 17 months he rolls in with a little bit of mousse in his hair. Again, just full disclosure, I did not do the tuft, but we did everything else. That's pretty good. Does not look like a hair transplant, nor does that. This looks natural. His wife comes to see me periodically for Botox and brought this picture in at 3.5 years. He's still got a bald spot. His front's holding up well. I just saw her last week. She's now about 6 years out from this case, and according to the wife, looks the same as he looked in this picture. So that's example number 1, a quick growing frontal U. This is example number 2, a slow growing frontal U repair. This is a little younger guy, I think he's mid to late 20s, lives out of the area, who had some type of hair transplant done elsewhere, and has a decent tuft, but really doesn't have much going on behind it. He also has a few spots in his tuft that are starting to thin. We talked about the pros and cons of doing those, and we opted to put a few hairs along the edge, but really he did not want to trim that tuft. He wanted to be able to go back to work with his face framed. And what he's concealing with kind of a comb around is this patch right here that doesn't have much hair. Notice this bald spot. And he is on meds. There's his crown, on meds. In the area that he's concerned about right up here, that did not get a good result from his initial surgery elsewhere. Here's this donor scar, again from elsewhere. This is a great view. You can see 2 hair grafts, probably a 4, a 3, 3, 2, 1. Hair grows like dandelions in your yard. There'll be one place, a dandelion with 2 flowers, someplace else, and with 3. You just pick them up and move them as follicular units, giving a natural result. Here's his donor strip out. We cut out his previous scar right through here, and he's sewn up in a 3-layer trichophytic closure. Here's the recipient area. You can see he's gotten some grafts with his previous surgery, but much of this I think was not hair that was put in. I don't know exactly what was done elsewhere. You can see there's some grafts there, but certainly not enough to deal with that whole central area. Some of these repair cases, we don't want to hit and kill the hairs that he's already paid for, so I make little slits up to and as close as I can get using magnifying glasses, making every attempt not to hit the roots that he's already paid for elsewhere. Here, these miniaturized hairs, I'm making the assumption that they're going, and so I'm just going to go right through there, and I'm sure I hit some of those hair roots, but they're on their last leg. And then after we put the holes in, we trim down the hair to facilitate a dense placement. And this is looking across the right side. Singles at the edge, doubles, triples as we get across the middle. And at the end of the day. And this is this is right in the middle of his tuft. We did put a few singles right in the middle, but notice where his tuft is. Notice where his tuft is and joining our hair transplant. We didn't do anything in here, and I think you'll see in his 16-month pictures he's lost some hair here. Here's his scar line at a week. And the recipient area at a week, he did reasonable cleaning, not as good as case number 1. There's a little bit of crust built up, but certainly not a whole lot. And here on the left side, He's really good, nice and packed, and I think that his area we'll see at 16 months. I think he's lost a little bit of this that we'll have to come back and deal with. He came to the office for his 1-month scar check. Pretty typical. Most things have shed. He's still got a few hairs that we've replaced, but not most everything we've put in has fallen out. Yet by preserving his tuft, when you look at him straight on, you can't tell anything's been done. Again, with a shorter haircut than I like, his scar is well hidden, and you look closely, and that trichophytic closure looks good at a month, a little bit pink like it's supposed to look. 3 months out, he emails this picture in. Again, doing kind of a comb across, and by preserving the tuft in the frontal U, he looks unremarkable. 8 months out, he sent this in. Was a little worried that he was a slow grower, and I agreed with that. Look at the crown. Despite being on medicines, it's getting bigger. So then he sent these pictures in at 12 months. And again, I would agree that it's still a little thin, a little slower growing, more like an 8 or 9 month result. And I think, frankly, at this point, I'd forgotten he was a repair case, because there's always some scar tissue on these repair cases, and it takes long. It's still not bad, but not great. But by 16 months, he had caught up. That's pretty good. And there's probably still another month or two of growing. I'd point out that his crown bald spot, despite being on meds, has gotten bigger. That's a pretty good mop of stylable hair. As is that. But if you look carefully, right here, here's where our case stopped on the sides, and he's lost a few tuft hairs. So when we come back to hit his crown at some point, we'll deal with that. That is the peril of the frontal U. And lastly, from above, no more show through of his scalp like he had in the initial pictures. And a final picture. He looks quite good. Crown's not responding to meds. Frontal U looks great. And this finishes out the case number 2, a slower growing repair frontal U in a younger fellow. So that summarizes 2 cases that review our rationale for offering frontal U cases. To summarize, in guys that still have a pretty good tuft, we can work around that tuft so that they look fairly unremarkable during the post-operative period, particularly weeks 4 to 10, when most guys have shed their grafts and are waiting for their native hairs to grow back. But the cost or the downside of a frontal U is that if and when that tuft goes, we obviously have to come back and hit it with additional surgery. But there's hair around to camouflage that second surgery, and it's a great option in select cases. Thanks.